Previously, we looked at the various divisions in medical laboratory and examples of tests that falls under each of these respective divisions. In today's lesson, we want to look at the test that is usually ordered by the nurse, the physician assistant, the physician, the type of investigation that is being conducted by the laboratory scientist. And this will bring us to the three main investigations that is usually performed by the laboratory scientist and reported to the clinician or the nurse or the requesting officer. And this will bring us to these three main investigations. So we have qualitative tests. So we have a qualitative test. We have a quantitative test. A quantitative test. Then we have a semi-quantitative test. A semi-quantitative test. So now let's look at each of these respective test investigations being carried out by the laboratory scientists in detail and how the tests are being described as either being qualitative, quantitative, or semi-quantitative. So the first one we want to look at is the qualitative test result. Qualitative test. So a qualitative test or a test is said to be a qualitative test. A qualitative test is a test that indicates the presence or absence of a substance. Presence or absence of a substance or condition or a condition. So that is the definition for a qualitative test. So all test results that are said to be qualitative are tests that is actually indicating that either a particular substance is present or that substance is absent. So we are looking at the presence or absence of a substance. So now let's look at when the substance is present, how does the lab scientist report the test result? When the substance is present, when the substance or the condition is present, when the substance is present, the test is reported. The test is reported as either positive or reactive. So basically, these are the two main terminologies that are used in reporting the presence of a substance. The substance is either reported as either positive or reactive. In fact, these two reporting terms are used interchangeably in laboratory practice, but there is some slight difference between them. Where positive appears to be more confirmed, reactive is just indicating the reaction by the substance. So we either use positive or reactive, where positive or reactive means the presence of the substance. So take for instance, example, pregnancy test. So a pregnancy test, pregnancy test, which actually tests for the hormone called HCG. The lab scientist can report HCG, and the HCG can either be tested for in the urine or the blood. So when we say urine HCG or urine pregnancy test or urine pregnancy test. So urine pregnancy test. P for pregnancy, T for test. So we can report urine HCG as a qualitative test result. It can be reported as positive, indicating the presence of the HCG. Urine pregnancy test can also be reported as what? Positive. So when result of this sort is reported either as positive or reactive, it indicates the presence of the substance. So we can say reactive. Then let's take a test like the hepatitis B surface, the hepatitis B test. And the hepatitis B test actually tests for what we call the hepatitis B surface antigen. Capital A small g is an abbreviation for antigen. So the hepatitis B surface antigen can be reported as positive, or reactive, where positive appears to be more confirmed. Positive or reactive. The HIV test can be reported as reactive or positive. So this is just to illustrate the reporting of qualitative tests. So when a test is being ordered and it is a qualitative test, or the investigation is a qualitative investigation, then the result is reported as positive or reactive when the substance is present. On the other hand, the absence of the substance is reported as negative or non-reactive. Where negative is indicating the absence of the substance, where non-reactive also means the absence of the substance. So each of the previous illustration I gave, for instance, if the HCG, which is the hormone that we test for during pregnancy, if it were to be absent, then the test result being reported by the lab scientists would have been negative or non-reactive. If hepatitis B surface antigen were to be absent, then that will be reported as non-reactive or negative. If HIV virus was supposed to be absent, then it would have been reported as non-reactive or negative. So basically, these are how qualitative test results are actually being reported. So the next one we want to look at is the quantitative test result. Quantitative test. Now, Quantitative test actually indicates the presence of the substance, but the result is reported in a numerical value. So quantitative test indicates the presence of a substance in a numerical value, and this value in a numerical value, and this value actually, that is, which corresponds, and the value corresponds to the amount, and the value corresponds to the amount or concentration of the substance. So it corresponds to the amount or the concentration of the substance. So we are looking at the test being reported in numerical value. So quantitative, coming from the word quantity, and that means that we need to quantify quantity. We need to quantify, and in quantifying, the test result will assume a numerical, coming from the word numerical, meaning number. So it will assume a numerical value. So that is for a quantitative test result. Take, for instance, in the measurement in testing for ECG, we only indicated the presence. That means it is positive. However, so we only indicated that it is positive. So that means, so a positive means that the substance is actually present. But if the substance is present or it is present in what quantity? So when we now want to estimate the amount or the quantity or the concentration of the substance, then that will bring us to what? The quantitative result. For example, the HCG can be quantified in blood. So HCG quantitative test will actually come with a value of say 84. So this is a value, this is a numerical value. So when the test results, for example, hepatitis B surface antigen, we can do a quantitative test for it, and in that quantitative test, it will assume a value, say for instance 143. So that this is a quantitative test result. Where the test results are reported in numbers, then that is a quantitative test result. And so when you are sending a request, there are some tests that can be performed as either a qualitative test or a quantitative test. And so when you say HCG, you need to specify whether HCG as a qualitative test or HCG as a quantitative test. So hepatitis B surface antigen, routinely we perform the qualitative one, and that is reported as positive or negative. When it is positive, maybe we want to quantify the amount of the surface antigen, that is the hepatitis B surface antigen. You want to know the quantity. When something is present, it might be that they are present in minimal concentration or they are present in higher concentration. So when we are trying to estimate the quantity, the amount, the concentration of the substance that we are saying it is present, that estimation, that analysis makes the test result to be a quantitative test result or test. So let's look at the third one. The third one is a semi-quantitative result. So the test semi-quantitative. So semi-quantitative test. So a semi-quantitative test actually indicates, so it indicates the presence of the substance. It indicates the presence, it indicates the presence of the substance. It indicates the presence of the substance, but it provides, not only does it indicate the presence of the substance, but it provides an additional information regarding the amount. So, but further provides an information regarding the amount or severity of the condition. The amount or severity of the condition. Severity of the condition. The amount or severity of the condition. So that is a semi-quantitative result. So let me just illustrate a semi-quantitative result. For example, in a urine investigation, in a urine routine investigation, that is in a urinary test, where we test for proteins, where we test for blood, where we test for ketones, just to mention a few. Proteins can be reported in the urine. In the urine report, we report proteins. Proteins can be reported as positive or negative. But when proteins or the substance is reported as positive, usually we want to indicate the amount of the substance, not in terms of numerical, but in terms of grading on a scale. So usually semi-quantitative result gives an additional information regarding the amount or the severity of the condition, usually on a scale or range. Scale or range. So when we say proteins are positive, we can actually put it in a range or a scale. So in a scale of +1 or +2. So in the scale of +2, indicating that the substance is actually, the amount is quite more as compared to the +1. We can have +3. So that is indicating the amount or expressing the amount in, this is grading. So, and we can also have +4. So proteins are positive, but that is +4. So this kind of reporting where the substance is present, but we use the plus, we try to grade it in order to indicate the amount or the severity of the condition, or to try to put it in terms of quantity but not in terms of numbers. That is called a semi-quantitative. So like this implies that we have higher concentration or higher amount of the substance as compared to this, and this is more than this, and this is more than that. So that way of reporting, putting it in a scale of pluses, that is a semi-quantitative result. Likewise, blood can be positive, and we can report it as +1 on a scale of 0 to +4, where 0 means the absence of the substance. So scale of +1, +2, +3, +4. So that is how semi-quantitative results are actually being reported. However, if the test is just reported as positive without any scale, without any grading, then that is a typical qualitative result. But in a qualitative result, where there is a scale, there is a grading of the presence of the substance, but not in terms of numerical value. That grading is said to be a semi-quantitative result. So the test result becomes a semi-quantitative result. So basically, these are the three main laboratory test investigations that are usually being conducted. Now, for a laboratory scientist, for a physician or a nurse or for a healthcare provider to be able to interpret laboratory test results, for all health professionals to be able to interpret laboratory test results, including the laboratory scientists, then the healthcare provider must be able to differentiate normal results from abnormal results, and the ability to be able to differentiate between normal and abnormal results implies that the lab scientist or the healthcare provider must have a reference in order to be able to tell that this particular test result is a normal or an abnormal test result. And this will bring us to the topic titled reference ranges. So we want to look at reference ranges. So when we say reference ranges, so reference range is also known as normal range. So a reference range is also known as a normal range or a reference interval So a reference range is also known as a normal range or a reference interval, and it actually indicates the range. It indicates the range of various laboratory tests and measurements that are considered normal for a given population. So a reference range is used interchangeably with normal range or used interchangeably with reference interval. So when we say a reference range, in other words, we are talking about normal range or a reference interval. And this interval actually indicates the range of various laboratory tests. So all the examples of the tests we mentioned are considered as various laboratory tests and measurements, and that are considered normal. So we call normal for a given population. Now, when we take the reference range the reference, so example, the reference range for HB, that is hemoglobin, sometimes can be abbreviated as AGB, for females is 12 to 16 in gram per deciliter. So this is the reference range. So reference is something we look at. So in laboratory test examination or investigations, we always have something to compare to in order to determine that this particular test result is normal or abnormal. So take for instance, you conducted an HB investigation, or you ordered an HB investigation for a patient, and the HB result that came from the laboratory scientist was say 13.5, and the individual is actually a female subject, so 13.5 gram per deciliter. So when we take this particular test result, how do I know that an HB value of 13.5 is normal or abnormal? This means that we will need something as a guide to be able to determine that the 13.5 is normal or abnormal, and that brings us to the reference range or normal range or reference. So usually all test results that are reported by the laboratory scientists, the result is reported with the reference at the other side. So that means that if I want to know whether this particular test result is a normal result or an abnormal result, I will be comparing this test result with this particular reference range, because that is the reference range for female individual. So looking at the value 13.5 actually lies between 12 and 16, and this means that the 13.5 is actually a normal result, is actually normal. However, if we take a result such as, so if we have a test result like say 10.5 gram per deciliter, when we compare 10.5 gram per deciliter with this reference range or reference interval or normal range, 10.5, it does not actually fall between 12 and 16. Hence the result 10.5, or this result is said to be what? Low. On the other hand, an HB value of say 17.6, so 17.6 gram per deciliter, if I'm comparing this particular test result with the reference range, we realize that 17.6 is greater than 16, which is the upper limit of the reference range, and that means that the result here is high. So here is normal, here is low, so the test result is actually what? High. So that is how we are able to determine whether a test result is actually normal or abnormal. When a result is abnormal, it either means the result is either high or low, if in the case of a quantitative test result. But if it is a qualitative test result, when the result is abnormal, there is only one possibility, that is, it is positive, or it is what? Reactive. So that is how we are able to differentiate normal result from abnormal result. So take for instance the PAC report of a patient is, let's say, 7.2 nanogram per ml, and the lab scientist says that the reference range for this particular patient is less than 5. If the reference range is less than 5, what it means is that all results that are less than 5 is considered to be normal. However, all results greater than 5 is considered as abnormal. So if we take a test result of say PAC as 0.6. So a test result of say 0.6 is less than 5, and hence the result is said to be normal. But when you take a test result of say 7.2 for this particular patient, 7.2 is actually greater than 5. And that means the test result is abnormal, and that abnormality is what? High. So that is basically how we are able to make an interpretation of the test result as either normal or abnormal. So the first step in interpreting a laboratory test result is to be able to determine whether the result is either normal or abnormal. When the test result is normal, then the result, if it is a quantitative test result, it will fall within the reference range. However, if it is abnormal for a quantitative test result, it is either above the upper limit of the reference range. So these two values, the first one is called the lower limit, whilst the last one is called the upper limit of the reference range. So a test result is said to be low when the value obtained is less than the first value, that is the lower limit of the reference range, and is said to be normal when it is either exactly on the lower limit value, or between the lower limit and the upper limit value, or exactly on the upper limit. However, the result is said to be high when the test result is greater than the upper limit of the reference range. Now, for all qualitative test results, results that are reported as either positive or negative, the reference range for all qualitative results is negative. In other words, it means that we don't want the substance to be present at all. So for qualitative results, we report the reference range is negative. So if you want to find out what is the reference range for proteins in urine, proteins in urine is negative. The reference range for blood in urine is negative. That means that we are not expected to see proteins, blood in urine. The reference range for ketones is actually supposed to be negative. So for qualitative result, if we ask a test like glucose in urine, the reference range is negative. So for most qualitative test result, they assume the reference is negative, that is the absence of the analyte or the substance that is being tested for. So basically, knowing the reference ranges and comparing the test result to the reference range can help the laboratory, help the healthcare provider or the lab scientist to correctly interpret the test result. So that is it. So basically, you first will have to be able to get hold of your reference range, then you compare the test result with the reference range. You do not need to memorize the reference ranges. The lab scientist generates the laboratory report or the test with the reference range by 8 so that you make reference to. Thank you.